Town Hospital, which basically means we look at every heart attack that comes in and make sure we're meeting quality, guidelines, and everyone's getting the best care possible. I'm really pleased to, sorry, I'm out of breath because I'm late. Is that one of
That's
the
not a good thing for everyone.
So we have a couple of things. I have Mr. Joseph Shenga, and he is the guy you want to know at Central Bucks Ambulance. He's the director of operations, RN paramedic extraordinaire. And I have, I don't need to introduce Melissa and Kelly from our marketing department, and Mikey, who's one of our cardiologists over there. So we're going to talk a little bit about heart attack care today. First, I'd like to introduce Joe again to come talk to you about 911 and what Central Bucks does for our community.
Well, thank you for inviting us. As you said, my name is Joe. I'm the Deputy Chief and Director of Operations for Central Bucks Ambulance. We cover the Doylestown area, including all this right here. So we're the primary agency for any EMS responses to this area. So specifically about heart attacks and stroke, the key is to call 911 as soon as you can. If somebody's having chest pain, jaw pain, shortness of breath, or diaphoretic, something's just not right, it never hurts to call. We will come, we'll do an assessment, we'll do an EKG, we'll check their vital signs, and we will get them to the hospital. If they're not sure they want to go to the hospital, we'll send the EKG to the hospital, we'll talk to the ER doc, and we'll make that decision together. For somebody that's having a heart attack, the faster we can get them to the cath lab, the better. Time is tissue is what they say, and I'm sure you're going to hear that again later. So we're the first step in the chain of survival. When you call 911, we're going to come, we're going to do that 12 week. We send it to the doctors in the ER, and when they confirm that it is a heart attack, then it goes to the cardiology department. They start getting the cath lab ready. It's the middle of the night. The cardiologists, the nurses, all those guys that are involved with that, they start coming in from home. So the sooner you call, the sooner we do that 12 week, the sooner the ball starts rolling in the hospital. Our goal is to have a 12 week within 5 minutes and to have the hospital notified of a heart attack within 10 minutes. For cardiac arrest, that's a no-brainer. It's always an immediate 911 call, but the most important thing you guys can start doing right away is hands-only CPR. The dispatchers will walk you through that, and they'll explain to you exactly what to do. And it's really simple. It's, hands on the chest between the nipple line, 100 times a minute, push down 2 inches, and just go for about 2 minutes, push out with somebody else. Us being local, we'll be here in 5-6 minutes, and we'll take over and we'll get them to the hospital. But the highest chance of survival is early AED use and early CPR. And we see that all the time. When we get ROS back, we get return spontaneous circulation back, it's because somebody in the community applied an AED and they did hands-on CPR. And I think when we have that, we have about a 30% ROS rate, which is pretty impressive. I'm not sure what the national average is, but that's what our average is. And that's phenomenal. That doesn't mean everybody walks out of the ER, or walks out of the hospital rather, but it gives them family time, and maybe it gives a life an opportunity to get in there and benefit others. So those are my points. Call 911 quick. Even if you're not sure, call hands-on CPR and rapid AED use.
And I believe all of the police departments, which also will respond to a 911 call, have AEDs in their trunk. So they're kind of there sometimes before you guys, sometimes not, but they bring an AED with them usually in the car. So that's huge. And I will say, and I don't know how to say this delicately, if these guys can get ROS, return of spontaneous circulation, to get the heartbeat back, you have a 30% chance. If they don't, it's not something that the ER usually can be able to do. So that's why 911 is everyone's best friend.
The only thing I will add, for a cardiac arrest situation, we've found and evidence has shown that the longer we stay on scene, the higher the chances of survival. So if somebody were to collapse in any of your buildings, we could very well be there for 20, 30, 45 minutes in that spot working that patient. So it's not like you see in the movies where we pull up, throw them in the truck and we go. We stay right where we're at and we provide the care there.
Often they're giving medicines, IVs, CPR. They often are on the phone with the doc at that time as well, working through what can be done.
Because literally everything that you are to do for cardiac arrest, we can do for cardiac arrest. So patients at home, we don't even transport anymore because the care is the same. Anything else?
No, thank you.
Any questions?
No.
Thank you.
Thank you. 5 different ambulance squads within Bucks County. bring, I did the numbers yesterday, Joe, close to 6,000 ambulance patients to Doylestown Hospital a year, which is much, the vast majority of the hospital transports that we get. They're everywhere. They're everywhere. They do an amazing job. The paramedics, they're saving the lives out there for sure. So I'm going to go really quickly. Joe touched on some of that. The hands-on CPR, that sort of replaces mouth to mouth. The data says that people are a little hesitant to put their mouth on somebody else, but if you can just circulate the oxygen that's already in the body quickly, that's nearly as effective as doing mouth to mouth. So that's why the American Heart has gone to that. Just pump on their chest. People say, the old song from
Staying Alive.
Yeah, Staying Alive. That's the beat you want to do. That's the cadence of the rapid chest compression. AEDs are saving lives. Call 911. And we talked a little bit about it. And Dr. Nike will touch more on those signs of a heart attack or impending heart attack, or even just chest pain that's kind of odd over the last few weeks that you should be getting checked out by a physician. So we're going to talk more about that EHAC or early heart attack care, which is a community promotion that we have here. And there's going to be a little bit of a website, a QR code in your folders. Joe talked about Central Bucks, sorry. Doylestown Hospital, just to boast a little bit, we are what they call a 4-star rating on our heart attack care. So all heart attack care, meaning whether it's, Elizabeth, I'm coming, or whether it's something that's what they call a STEMI, like the medium cath lab, or an NSTEMI, which is a heart attack, but you don't need to go immediately to the cath lab. 4-star ratings on all of that, 4 out of 4. We're doing great. We do hold awards through American Heart for our STEMI receiving, for our NSTEMI receiving, as well as the American Heart Cardiology, the platinum award for that. And I will say, I'll boast, we did just receive our 4th, every 3 years, up to 12 years, been accredited with the American College of Cardiology as an accredited chest pain center with PCI, meaning we can do stents. Last thing I'll say, Joe talked about getting us to the cath lab really quickly. If you come in by ambulance with a heart attack, we can get you from the door of the ER to the cath lab in 49 minutes. Time is muscle. If you come in through the front door, it's going to take us 64 minutes median time in the ER to get you up there. So you're saving 20 minutes of heart time, nearly 20 minutes this year. 15 minutes of heart time, just by calling them, because they get the IV started. They'll give you some medications. The EKG is already done. So you can say 15 minutes doesn't sound like a lot. Heart muscle time, 15 minutes is significant. So I'd like to introduce Dr. Nike, who I had written down all your credentials, but I don't have them in my brain. But his method of teaching will speak for itself. He's been with Doylestown Hospital Cardiology since 2013. 2013, and 2017, and graduated with his medical degree from Drexel.
Yeah, Temple Medicine.
Temple Medicine, and we're very happy to have him. And his office manager here is Melissa. She is the one you're gonna kind of coordinates everything in the office there. And that's all I have.
I went to Drexel. There you go.
All right, good afternoon, everyone. Good to see you. Thanks for inviting us. So I'm a Temple grad, went to med school there, got a master's here first. Went to Ursinus College. So I'm a local guy, born in West Philly. Then I did all my medical training at Hahnemann, former Hahnemann Drexel. So I know we talked a lot about heart attacks. It's a very touchy subject. It can be scary, all right, and obviously you can die from a heart attack. But one of the things I want to focus actually on is prevention. How do we not get there or try our best to avoid that? Because once you have one, there's no going back. It affects you for the rest of your life. It affects your family, your livelihood. So we're going to focus on a few things in terms of prevention. All right, so heart disease is the leading cause of death in the United States, and it exceeds all forms of cancer in both men and women. And it can be preventable to a significant degree, but you have to play an active role in order to accomplish this. So 1 person dies every 36 seconds in the U.S. from cardiovascular disease, and about 655,000 Americans die from heart disease every single year. And that's 1 in every 4 deaths, so 25% of deaths, which is significant. And it costs the U.S. about $220 billion each year. And this includes the cost of healthcare services, medicines, and loss of productivity due to death. So coronary artery disease, or as we call it, CAD, it's the most common type of heart disease, killing approximately 366,000 people every year. Approximately 18.2 million adults aged 20 and older have coronary artery disease, almost 7%. And approximately 2 in 10 deaths from coronary artery disease happen in adults less than 65 years old. So in the U.S., someone has a heart attack every 40 seconds, and every year there are approximately 805,000 Americans that have a heart attack. And of these, 605,000 are first heart attack, 200,000 had a prior heart attack. So one of the major risk factors is if you've had a heart attack, you have a higher likelihood of having a second. And about 1 in 5 heart attacks are silent, so some people don't know that they even had a heart attack. They don't have chest pain or shortness or breath or sweating. The issue is the damage is done, but the person's not aware of it. So the cardiovascular system involves the heart. That's the main anatomical pump that fuels the system. It's an intricate series of conduits, which include arteries, veins, and capillaries that traverse the whole human body that carries blood. So the cardiovascular system, as I mentioned, is the organ system that distributes all blood to the body. And then the major function is to transport, using blood as the transport vehicle for blood, oxygen, and certain nutrients. So it transports oxygen, which is good, and then it removes the waste of carbon dioxide, which needs to be refreshed and replenished by the lungs. It transports nutrients and removes waste, fights disease, transports hormones that are vital for life, and it also helps regulate body temperature. So when we talk about a heart attack, this mouse is showing up on the screen, but there are 3 major arteries that can be blocked. We see the right coronary, and then the left main coronary, which branches off into the left anterior descending coronary artery, and then the circumflex artery to the side. So there could be a blockage anywhere. Sometimes we'll have clues as a physician as to where the blockage might be, but anywhere along the tree this can happen, and the key is to try to open things up as soon as we can. So major risk factors for heart disease. Number 1, smoking or tobacco use. Hypertension or high blood pressure, high cholesterol, diabetes, obesity or being overweight, and sedentary lifestyle or lack of exercise. So it's important to know your numbers. Know your blood pressure, know your cholesterol, or as we call lipid panel. Total cholesterol should generally be less than 200. The LDL or bad cholesterol should generally be less than 130. Depending on your risk factors, there might be a tighter control that's recommended there. And then the HDL is the good cholesterol, and typically you want that to be greater than 60. Then triglycerides is another fatty component, which should be less than 150. And then the hemoglobin A1C. This lets us know whether patients are diabetic, pre-diabetic, and controlled in terms of diabetes. And then weight or body mass index. So we're going to go through these one by one. So tobacco use. So it leads to systemic disease and disability. It harms essentially every organ system in the body. I tell patients when you smoke, all bets are off. So smoking is the leading cause of preventable death. So no matter how much you smoke tobacco, dangerous to your health. It affects the entire body. There are no safe substances in any tobacco products. They have acetone, tar, nicotine, carbon monoxide. And it's the leading cause, as I mentioned, of preventable death. And you can barely see it here, but you can see how every organ system essentially is affected. Negative effects of tobacco are numerous to the human body, and almost every organ system is affected detrimentally. And they're both short-term as well as long-term. So in terms of the cardiovascular system, smoking damages the entire cardiovascular system. It raises the blood pressure, weakens the blood vessel walls, and it causes plaque rupture or cholesterol buildup to kind of break up and increases the risk of blood clots as well. So nicotine itself causes blood vessels to tighten and it restricts the flow of blood. And this leads to also peripheral arterial disease over time, so you can get blockages quite often in the legs, and patients can lose their limbs as a result. So it cumulatively increases the risk of heart attacks as well as strokes. So when we talk about tobacco, say avoid them all. Cigarette smoking, vaping or e-cigarettes, chewing tobacco, cigar use, even hookah. Nothing belongs in your lungs other than air. All right, and that's what I tell them. So you want to contact a health professional for any assistance that they can offer in terms of quitting. And over the counter, you can use nicotine patches, gums, and lozenges, which are very effective. So hypertension or high blood pressure. So hypertension, as I mentioned, equals high blood pressure. And blood pressure typically higher than 130 over 180. It's recommended that we keep it lower. Salt or sodium plays a major role in terms of increasing your high blood pressure or increasing the risk of hypertension. So you want to try to consume less than 2,000 milligrams a day. Some patients, many people actually are genetically predisposed or there's influence there because it tends to run in the family. So you do want to pay attention to your family history. So we break primary hypertension into a few categories. We call it primary or essential hypertension. And this is for most adults because there's no particular identifiable cause. And this tends to occur as we get older. Our vessels stiffen, so the blood pressure raises. Then there's secondary hypertension, and this is high blood pressure due to some other underlying medical condition that can include thyroid disease, kidney disease, the adrenal glands, congenital vascular disease, or obstructive sleep apnea. So medications can also contribute to it, like birth control pills, cold remedies, or nasal decongestants, over-the-counter pain relievers, and also prescription drugs. Also, legal drugs can affect it, such as cocaine and amphetamine. So you obviously avoid that. So these are some other risk factors that influence hypertension. Age, as we get older, the risk goes up. Family history, high sodium, as I said, tobacco use, obesity, physical inactivity or lack of exercise. High alcohol intake also affects this. Chronic conditions like diabetes, chronic kidney disease or CKD, or obstructive sleep apnea. Race also affects certain people, and also stress plays a role. So what we recommend is what's called a DASH diet. So this is dietary approaches to stop hypertension. So this is a lifelong healthy eating plan that focuses on cutting down on salt from the diet and also adding rich potassium, calcium, and magnesium. Too much salt increases the blood volume, which increases your blood pressure. That makes it tough for us to control. And you should ideally prepare your own food to help limit the amount of sodium you consume. The reason we all go out to eat is because it tastes good. Why? There's a lot of salt. All right, so that's why you want to really try to minimize doing that. So as I mentioned, low sodium diet, in terms of a healthy diet, you want to eat plenty of fresh fruits and vegetables. You want to try to avoid fried and fatty foods because this is not good for your health. Minimize red meat and pork because they tend to be high in cholesterol. That you want to try to eat lean protein, fish and chicken primarily, and fish is high in omega fatty acids, which is also beneficial for heart health. So then high cholesterol. So cholesterol is a waxy substance that's in your blood. And your body needs cholesterol to build healthy cells, but the issue is high levels increases your risk of heart and vascular. So the high cholesterol leads to fatty deposits in the blood vessels. The deposits then grow. It makes it more difficult for blood to flow through the arteries. And the deposits can also break off suddenly and form a clot that causes heart attack or stroke. So typically your lipid panel should be checked at least once a year by your primary care provider. And the LDL bad cholesterol should be checked along with with the HDL, which is the good cholesterol and triglycerides, as I mentioned before. And the risk factors for high cholesterol, poor diet, obesity, lack of exercise, smoking, age. As we get older, our body starts to betray us. So it's what happens. Why we don't live forever. And then diabetes. You can see that there's an overlap in terms of risk factors for conditions. So they should start to, kind of bring it to their head. So prevention in terms of this, low salt diet that emphasizes fruits, vegetables, and whole grains. Limit the amount of animal fats and use good fats in moderation. Lose extra pounds and maintain a healthy weight. Quit smoking or don't start at all. Exercise on most days of the week for at least 30 minutes. Drink alcohol in moderation, if at all. And then learn to manage stress. So diabetes. All right, so diabetes is a group of diseases that affect how your body utilizes blood sugar or glucose. Glucose is an important source of energy for the cells that make up your muscles, and it's the main source of fuel for the brain. So no matter the type of diabetes, it leads to excess sugar in the blood. And this ends up leading to serious health problems, and the poorer the blood glucose control, the higher risk of complications. So insulin is a hormone that comes from the pancreas. And this enables sugar to enter from the blood into your cells. This lowers the amount of sugar in your bloodstream. And if sugar cannot move into the cells, it then builds up in the bloodstream, which leads to many systemic complications. And this affects the cardiovascular system. It causes nerve damage or neuropathy, which made a lot of patients kind of lose their sensation. Kidney damage, what we call nephropathy, eye damage, retinopathy, limb damage, so decreased blood flow that could lead to amputation, skin conditions, primarily infection, hearing impairment, Alzheimer's disease, and also depression. So type 1 diabetes, it's a condition that cannot be proven. We don't know exactly why it happens, but the immune system attacks and destroys insulin-producing cells in the pancreas. This usually happens in younger people, adolescents, that we tend to see it, but it can happen as you get older for some reason in adults. And we think it's possibly caused by a combination of genetics, susceptibility, as well as some environmental factors. So type 2 diabetes, which is the most common, it's acquired, but we don't exactly know why. The cells become resistant to the action of insulin. And the pancreas is also unable to make enough insulin to overcome that resistance. We think that this is due to both, again, genetic and environmental factors. Obesity is strongly linked to the development of type 2 diabetes. And prediabetes is potentially reversible. And that's when the blood sugar levels are higher than normal, but not high enough to classify diabetes. And this can ultimately and often lead to type 2 diabetes. There's a condition called gestational diabetes, which is potentially reversible. And this occurs in pregnancy. But it usually resolves after delivery for many people. So the placenta produces hormones sustained the pregnancy, but the hormones also make the cells more resistant to insulin. So this can cause excessive growth of the baby while in the uterus. This can lead to some conditions such as preeclampsia, which is high blood pressure, protein in the urine, heat swelling. This ultimately can cause fetal compromise or cause risk to the baby. The baby can die of this as a result, and this can also lead to subsequent gestational diabetes for other pregnancies or type 2 diabetes. So then, how do we manage this? So checking the hemoglobin A1C measures your average blood sugar for the past 2 to 3 months, and this helps with management. So this is something your primary care provider can check, your cardiologist can do it as well. Normal is less than 5.7%, and prediabetes is between 5.7 to 6.4%, and then diabetes is anything greater than 6.5%. The diagnosis is typically made by a fasting blood sugar greater than 1.6, though, and the treatments typically include medication, so oral medications and also injectable insulin. But also lifestyle plays a big role: weight loss, diet, exercise. So again, you're kind of seeing the pattern of what obesity. So we recommend that you routinely monitor your weight and body mass index. The body mass index is this formula that you see here, your weight divided by your height squared. And then normal body mass index is between 18 and 25. Overweight, 25 to 30. Then obesity is once you're above 30. So if you're 30 to 35, that's considered obesity. Anything above 35 is morbid obesity. I tell patients you should weigh yourself daily in the morning without hope, all right? Because you need to see what's in front of you. We have patients that come in and they don't want to get weighed. I don't think that's healthy, all right? Because you're kind of turning a blind eye to something that you have control over, and we can help you. So obesity health risks: heart disease and stroke, high blood pressure, diabetes, some cancers such as colon, breast, uterine, kidney, and esophagus, gallbladder disease and gallstones, osteoarthritis or joint issues, gout, breathing problems, especially obstructive sleep apnea and asthma. So obstructive sleep apnea often flies under the radar. It's a breathing condition that's often linked to obesity. And this can cause a person to snore heavily and briefly stop breathing during sleep. This can also cause daytime sleepiness. The issue is you're not getting enough oxygen to the body. And this increases the risk of heart disease and stroke. So treatments would include CPAP, or the machine that helps you breathe at night. It opens up the airway, oral appliances, weight loss, and also surgery. So sedentary lifestyle or lack of exercise. So we typically recommend a minimum of 150 minutes of moderate aerobic exercise weekly, or 75 minutes of vigorous aerobic exercise weekly, or a combination of both moderate and vigorous activity every week. So here's a diagram that we have in our office. So we tell patients at least 30 minutes of walking or moderate intensity exercise at least 5 days a week, for a total of that 150 minutes, or at least 25 minutes of vigorous aerobic activity 3 days a week at least, for a total of 75 minutes, or a combination of the two, and some degree of moderate to high intensity exercise 2 days a week. All right, so some lightweight lifting or something. And for lowering blood pressure and cholesterol, you should average about 40 minutes, 3 to 4 days a week, in terms of moderate to high intensity exercise. So other risk factors can affect your health, including unhealthy diet, excessive alcohol, and high stress. So unhealthy diet. I kind of talked about some of this, and again, there's overlap. So too much salt or sodium increases your risk of vascular and overall health problems. You should consume less than 2,000 milligrams of sodium a day, which is 5% daily value, or less sodium considered low. 20% or more sodium per serving considered high. And I'm going to talk about reading labels in a minute. So you want to read nutrition labels, because the nutritional balance is important. You want to eat fresh fruits and vegetables, low fat, low cholesterol, and food choices matter. What you put in your body, you should think about that going through your system. You think your body's really going to like this or not? So just kind of paint that mental picture. And then you also want to pay attention to the serving side. I often tell patients, if you go out to a restaurant, what do we want? We want our money's worth, right? So we pay these relatively high prices and get these big portions. I challenge you to eat half of it and take the rest home. All right, so now you have another meal at home, you eat half the food, so you're not over binging. I know we like to overindulge a little bit, but I challenge you to eat half of it and take the rest home. Take that for a second. Because, you don't want to throw it away. So I'm not a wasteful guy. So this is a nutrition label. So you can see here, everyone know how to read it? Maybe you don't want to raise your hand, but hopefully you can read a nutrition label. All right, I don't want to insult anyone's intelligence, but this is eye-opening. All right, and when I started early in medicine, I had an aha moment, because this can get depressing if you really start to read it, because you'll realize what you were doing wrong and what you need to do. All right, but I challenge you, once you start to read it, it gets easier and you understand the choices that you should and shouldn't make it. And it does affect how you move forward. All right, so at the top you see nutrition facts. Number one, the serving information. So this lets you know how many servings there are per container. All right, so you may grab a soda or something. You might think, oh, this is already packaged, it's one serving. But if you read the label, you'll see it's 2, 3, or 4. That means you should only be drinking maybe half of it in one setting, as opposed to the whole bottle. So that's why the serving is important. And then calories. So this is the amount per serving, not per package. All right. So now let's grab that bottle of soda, which is 2 servings, and now you have to double it to let you know how many calories are in the total bottle. Now most packages will let you know how many servings per container. So they now have put that in most things. So then the next section is the nutrients. All right. So this lets you know how much fat and breaks it down into saturated fat and then trans fat. And again, the lower the fat, the better. Same with the cholesterol. The lower the cholesterol, the better. And then sodium. You see, I think that says 850 milligrams of sodium. Sodium is in everything. All right, it's in everything. So you don't even realize it because sometimes you can't taste how much sodium is there. So in this, again, this was the serving of lasagna, and 850 milligrams per serving. All right, so if you eat that whole thing, you've now consumed your entire daily worth of, more than your daily's worth of sodium. All right, so you need to be very careful. Then it'll tell you about total carbohydrates and dietary fiber. Dietary fiber is actually a good thing, right? So that helps the digestive system function well. And then it'll break down the total sugars, the added sugars not. Then protein is there, protein is good. And then it'll break down the value of the vitamins at the bottom. All right. So again, the quick guide to percent daily value, that number 4 there is, 5% or less low, which is good. Anything greater than 20% is high, right? So you kind of use that rule. Generally shoot for less than 20. You can average around 5, that's all right. Average around 10, that's all right. So excessive alcohol. So you want to limit alcohol intake to 2 drinks or less per day for men and 1 drink daily or less for women. There are calories in alcohol too, all right? So just remember that when you're trying to lose weight, you have to think about the alcohol as well, right? That definitely has calories. So what's considered a drink? 12 ounces of a 5% ABV of beer, 8 ounces of a 7% ABV of malt liquor, 5 ounces of 12% ABV of wine, or 1.5 ounces of 40% ABV or hard liquor. So excessive alcohol, obviously, I think, it impairs your function, all right? That's why you shouldn't drive. But it also has health problems, such as high blood pressure. It leads to heart failure in many patients, all right? So excessive drinking weakens the heart. It leads to heart disease, but also arrhythmias as well, like atrial fibrillation, which then increases your risk of stroke significantly. It also causes liver damage or leads to cirrhosis, whereby the liver, that's the main filter in terms of all the nutrients of the body, that'll shut down. It can lead to stroke, digestive problems, and also cancer. Right? So there's a link to breast cancer, mouth cancer, esophagus cancer, liver. So high stress. So stress is a part of life. All right, and high levels of stress can adversely affect your overall health, especially the heart. This increases your blood pressure, but also can lead to heart attacks. So you want to try to find ways to manage stress in a healthy manner. Find some personal time, spend yourself, maybe just get away for a little bit. Actually, I know it's hard with kids and family, so you can though. Everybody needs a little time to kind of. And exercise regularly, as I talked about, exercising in a regular interval definitely helps your overall well-being. You want to eat well, kind of the things that I touched upon before, but also build healthy relationships. Humans were made to interact, right? So interaction is key. And we want to have healthy relationships both at home as well as at work. right, so final tips. All right, so you generally want to find a healthy balance in terms of your lifestyle, healthy diet, healthy eating habits. You want to find healthy ways to deal with stress. As I mentioned, don't smoke. All right, that's the number one preventable thing that you can do that so much in terms of adverse health. So you want to go to your primary care provider and specialist on a regular basis. You should usually see a general practitioner once a year, right? And then if you have a cardiac condition, it depends, right? Generally, it's at least once a year, sometimes sooner if you have certain conditions. They'll help guide you on the path to staying healthy, all right? But you have to do your part. This isn't like an automobile dealership, pun intended. You know, if your brakes squeak, you can bring it in. You know, you got to drive, and that's fine. If your brakes square down, you bring it in. But we have patients that come in and they, you know, have a health problem. They think, oh, we can just change the brake pads and send them out, but that's not the way it happens. All right. So it's definitely not a quick fix. It's something that you have to be working on. So your heart is literally in your hand. All right. So that's pretty much that. And fortunately, we're kind of past the pandemic, so I don't have to get back. It's not completely over, but it's definitely much better. So, all right. So finally, if you feel a heart attack symptom, just briefly in terms of heart attack, quite often patients will have chest pain, chest pressure. It might radiate up to the neck, to the arm, usually the left side. As I mentioned, some patients don't have chest pain. They may have chest pressure. Generally, we'll say pain, you know, as providers, but you may call it something else. It may be in pain. It may be a sensation. All right. So whatever you feel that doesn't feel right to you, your body knows itself. All right. So if something's off, just pay attention to that. Some patients feel short of breath. They don't necessarily feel chest pain. Some patients feel sweaty, lightheaded, feel like they're going to pass out. All right. So you want to pay attention to all of these signs and symptoms, and call 911, right? Quite often in women, it's interesting, they don't always present the way men present, and that's because of the estrogen that's in the body, right? So women may not always have that crushing chest pain. Actually, they often don't have it. They'll have some other vague symptom, right? Nausea, vomiting, exactly, right? So call 911, don't wait. The longer you wait, the longer it takes for us to get to the heart in terms of fixing things. Once the heart starts to get damaged, there might be minimal reversibility in it. All right. Same thing with the stroke, right? So you want to call 911. The ambulance, the EMS professionals, they can get there. They can start to treat right away. They can diagnose what's going on. They have advanced measures that can help get you squared away in terms of stabilization, get you to the hospital much quicker.
And even if they come and you're not having that big heart attack, it doesn't mean that there's not a heart issue going on.
Correct.
It doesn't mean you're clear, okay, I'll
Yep,
talk to my doctor more.
and they'll get you to the hospital.
So we're,
The other issue about driving, you want to be very careful. You know how sometimes you'll see on TV, how did that accident happen? Yeah, that's the problem. The heart probably stopped, all right, because someone felt well enough to drive to the hospital and they lost consciousness.
people think I can get there faster, I live right around the corner, but remember the slide I said, if the ambulance is bringing you, you are up in the cath lab much faster than if you're driving yourself to the hospital. And if you're driving your husband to the hospital, you can't do CPR on it.
Yeah. So and all bets are off once these things start to happen. You want to be very careful. So it's just safest to call 911, get to the hospital. And one last thing, interesting, we're seeing patients younger and younger come in with heart attacks. Okay, we're seeing patients in their 30s and 40s, and they're not all smokers. Some are not. That's concerning. We don't know why this is. I had a guy last week came in, had some. He didn't even actually have chest pain. Yeah, he was working out in his lawn, and then kind of felt a little sweaty. Had a funny sensation in his arm. Got inside, thought he could cool down, and said, "No, something's not right." He called 911. Fortunately, after talking with him, called 911. They got him in. He was having a heart attack. All right, but he waited because he called his family member. He thought he was okay. His heart's damaged. Right, so we're going to try to hopefully see if his heart can recover. We'll be able to open up the artery. But when the heart's damaged, it becomes weak. If it becomes weak, it has a tendency to right? And even if you survive a heart attack, you can go home, but your heart's weak and it can stop. So sometimes patients need advanced measures like defibrillators.
I had one lady who came in, she had such a terrible, and she was having a big heart attack. So it's very odd sometimes the presentation.
So be careful, right? But again, prevention is key. That's why I wanted to spend primarily the time talking about prevention, because there's a lot that you do to help your overall health.
Actually, the American Cardiology has a philosophy that says a heart attack is a missed opportunity because medicine or people weren't aware enough of how to have prevented that. That's could be a preventable, result of living a healthy lifestyle, and they feel like heart attacks are a miss because we miss something earlier on, often.
All right, so we have a few minutes. Any questions? I can field some questions. Yes.
So, like, if you're actually, you don't have high blood pressure, you don't have high cholesterol, do you have any idea, like, what percentage, like, for that person, to actually have a heart attack? Does it happen, like, very, normally, or,